How do I understand my high-risk breast MRI report? If you have been told you need a breast MRI because your risk for breast cancer is higher than average, understanding your report can feel overwhelming. But knowing what the results mean is important for making informed decisions about your health. Let's walk through the key parts of a high-risk breast MRI report so you can better understand what your doctor is telling you. First, the report will start by explaining why the MRI was done. For high-risk individuals, this is usually because your lifetime risk of developing breast cancer is 20% or more. This increased risk might come from genetic factors like BRCA mutations, a strong family history, or other known risk factors. Knowing this helps you understand why regular screening with MRI is recommended for you. Next, the report describes the technical details of the MRI itself. This includes the types of imaging sequences used and whether a contrast agent was given. Contrast helps highlight areas inside your breast tissue, making it easier to spot abnormalities. These details ensure the images are of good quality and can be compared over time to see if anything changes. The report also discusses the makeup of your breast tissue and the level of background parenchymal enhancement, or BPE. BPE refers to how much normal breast tissue shows up after contrast is given. Higher BPE levels can sometimes make it harder to see small abnormalities, but they are also linked to a higher overall risk of developing breast cancer. Your doctor will consider this when reviewing your results. A crucial part of the report uses the BI-RADS system, which helps standardize how findings are described. BI-RADS stands for Breast Imaging Reporting and Data System. The categories range from 0 to 6. A BI-RADS 0 means more images or tests are needed. BI-RADS 1 indicates no signs of cancer. BI-RADS 2 shows benign or non-cancerous findings like cysts. BI-RADS 3 suggests a finding is probably benign, with less than a 2% chance of being cancer, and follow-up imaging in 6 months is usually recommended. BI-RADS 4 indicates suspicion of cancer, with subcategories 4A, 4B, and 4C representing increasing levels of concern. Usually, a biopsy is advised for these cases. BI-RADS 5 means the findings are highly suggestive of cancer, with a 95% or greater chance, and a biopsy is strongly recommended. BI-RADS 6 is used when a known cancer is being monitored. Your report will describe any areas of concern using specific terms. For example, it might mention a mass, which is a solid lump, or a focus, which is a small area of enhancement. Non-mass enhancement refers to an area that lights up on the MRI but does not from a clear lump. The radiologist will evaluate these findings based on their shape, edges, and how they change over time. The report also compares your current MRI with previous scans. This helps your doctor see if anything has changed, grown, or stayed the same, which is important for deciding next steps. Finally, the report will include recommendations. For high-risk women, this might mean continuing regular MRI screenings every year, possibly combined with mammograms. If something suspicious is found, your doctor may suggest additional imaging or a biopsy to get more information. Remember, it's always best to discuss your MRI report with your healthcare provider. They can explain what the findings mean for your personal risk and help you decide on the right next steps. Keep in mind that a high-risk breast MRI is a valuable tool for early detection, but it is just one part of your overall health plan. Follow your doctor's advice, stay up to date with screenings, and maintain open communication about your health.